right, we'll go ahead and begin the forum tonight. Thank you for taking the time tonight to join us for this important forum on mental health in Itasca County and our candidate for sheriff's stance on these topics. This forum is carefully structured to spotlight recent Minnesota statutes that impact our residents and communities. Specific questions will be presented tonight to the candidates that have been developed by a planning committee comprised of NAMI, the Local Advisory Council of Itasca County, First Call for Help, and the Crisis Response Team of Itasca County. Each question will be presented by a committee member and will allow a maximum of 5 minutes for each candidate to respond. The rotation for candidate will start with the response that's randomly pulled for each round. 6 questions tonight will be presented during this forum, and the remaining time will be used for open forum mental health policy related questions facilitated by Miriam Barkas and Tom Gaffney. The guidelines for engagement at tonight's events are one of respect and professionalism. Thank you to the candidates for prioritizing this event and participating. And now I'll invite our first committee member to the podium to present the question, and Catherine will guide us in the timing.
First candidate is Mr. Carlson. The question is, what is your understanding of the nationwide implementation of 988 and its benefits as related to mental health distress calls in Itasca County?
Does this come out of here or not?
I believe it does.
Okay.
And what is it, I guess, is another part.
Can you give me the question one more time?
Yep. What is your understanding of the nationwide implementation of 988? What is it, and its benefits as related to mental health distress calls in Itasca County?
Okay. 988 is a suicide crisis line that's just been recently implemented in Itasca County. In fact, it was a soft implement on July 16th of this year. And what that does is when a call comes into the county dispatch center, they're required to dispatch that out to a mental health crisis hotline, and they'll transfer them over to 988 so they can get the mental health services or suicide services that they need at the time. It's a new program, and it's still in the implementation process. There is a commission throughout the state that helps agencies collaborate with that. Currently at Itasca County Dispatch Center, there's 23 dispatchers that are being trained and working through this process right now. I think it helps right now because we do have a lot of calls in the county that are mental health related. We do numerous welfare checks, at least in Grand Rapids and Itasca County Sheriff's Office on a daily basis. And even though we've had training in mental health crisis intervention, officers are still not trained to the level that they need to be as a mental health professional, and we need to continue working on and providing that training to officers. They're exposed to difficult situations throughout their career, and a lot of these individuals are, really in crisis, and an officer only has a base knowledge of what we can do to help them. We need to get them out to crisis response team at 211 or bring them to the hospital, and the 988 system is going to help us get more services to them in a better fashion so that they're able to hopefully help a lot more people in the county. And like I said, this is a work in progress, and hopefully these things will develop and work out great in the coming years ahead.
And we'll be moving to our right for the next. All right.
So with this suicide prevention training in Itasca County, we're more ahead of the game than places like Minneapolis. We have a pretty great crisis response team here in Itasca County that we can get to these people that need help. Suicide prevention is near and dear to me. Less than 2 years ago, my brother had taken his own life, and we need to work with stakeholders and everyone involved to break down these stigmas make it so people can get the help they need and, get these people taken care of.
Yeah, the emergency hotline is a valuable tool where they should be able to just confidentially call and be directly transferred to the help that they need. First call for help, other counselors, hospital staff, law enforcement should be one of the main first responders also to go to that, just to make sure the person is safe and that there's a safe environment for the rest of these other people to respond to. Sometimes the person just wants to talk, and that is great. That's a good avenue to get people healthy, to keep people safe, including the first responders, the officers, and everyone involved. There's been a national suicide hotline for quite a while. I believe it's an 888 number that's been utilized throughout the country. This one is more of a more like 911 rather than an 800 number, 988. Very quick to dial.
This question will be directed in the same order that the candidates spoken. What are the additional types of mental health services you believe are important to develop within the Itasca County Jail?
Okay, I think that crisis intervention training, whether you're in law enforcement, working on the road, or in the jail, those same trainings are directly related to a jail position. When we arrest somebody that is having a mental health issue or they're suicidal and we bring them into the jail, it doesn't stop at the door. Those jailers have to work with that person over a time frame that they're going to be there, and if they don't have that training they need in order to work with a mental health issue, then we're on the downside of that and we're not providing the best service we can. Also within the jail, we need to have a crisis service team in there, a crisis response team that's able to come into the jail or be at the jail housed there, so that when we do have an individual come in, we can get the needed services to them. And there could be medications that need to be brought into effect on keeping their mood calm. And a lot of times we'll bring people to the ER first, where they'll see a doctor and they're cleared by a doctor, and they may be medicated at that time, so it does calm their behavior down. But in the jail itself, I don't think makes a difference if you're looking at it on that side or on the road side. They all need to have continued training on crisis intervention training, know what the community resources are available. And so if there's, with COVID, we have, maybe somebody's out sick from the crisis response team in the jail. We need to be able to get a hold of 211 so we can get our local crisis response team over to the jail to make sure that they can provide that service. And having a medical profession on staff so that if there is medications needed, we can get those medications prescribed to them and make sure that they are getting the services they need.
Thank you, Jeff.
So as far as inmates going, I would have trained CRT staff in the jail, or make it our current CRT program have space in our jail to help these inmates. And then as far as with the law enforcement jail staff, as a chief in Ashwaubenon, I created a program called Checkup from the Neck Up. Our police officers are allowed 6 visits to a mental health practitioner that does not go on their insurance, and it doesn't go in their record or anything, and they can go and get the help they need just to make sure that they're better equipped to do the job that we need them to do every day.
Thank you, Joseph.
I think it's very possible that they should have a dedicated space. The jailers know immediately, get that party out of general population, get them off by themselves, get first call for help there. First call for help would also need to have some specific training Leave your purse in your vehicle, leave all your other sharp objects, all that stuff in the vehicle, no cigarettes, no lighters, can go inside the jail. If they are also trained in that, it would just speed up the process. The staff needs a lot of other training. I mean, they're very, very good at dealing with people, knowing when people are having emotional issues, whatever it may be. But this kind of goes a level above. You have to be able to read almost into the person's head, into their mind, and kind of know what they're thinking. You can't always do that, though. The smart thing is, don't be afraid to call for help. There's many, many services out there that can help inside of the jail to help attend people, to keep them healthy and keep them safe.
Thank you, Dale.
This next round, Dale, we'll start with you.
Okay.
What additional strategies or policies will you implement to assist your own employees in coping with mental health issues such as, but not limited to, depression, post-traumatic stress, and burnout?
As far as related to the employees, burnout is a very serious problem in our profession. It's easy to get hard-hearted. It's easy to get burnt out on the job. I've thought about maybe an officer sabbatical. If the time is needed, if an officer, whoever it may be, dispatcher, jailer, clerical, road person, if they need some extra time, maybe an extra week, 2 or 3 weeks off to get their head together, something that I would possibly try and look at. More training from group trainings with first call for help, with the hospital staff, with emergency first responders, fire department. Let's get together and talk about how to do this better. Let's sit down and what can we do to help keep each other healthy. I would probably look at some national conferences. There's some very, very excellent, not that there's not around here, national speakers to come into our area to teach us and train us and show us how to stay healthy. Different supplements, exercise routines, diets, and just lifestyles, how to get away from the job. And when you come back to the job, to be able to do your job healthy. Insurance probably will pay for some of it. Some of it will probably have to be a dedicated payment, either from the departments or out of the person's pocketbook. Maybe a supplemental program to help people to be able to afford that.
Okay, I think that I look at law enforcement. You know, I've been doing this for over 20 years, and if anybody were to look across the state in the last few years and what happened after the George Floyd incident, and we had a number of officers across the state of Minnesota that PTSD'd out of the job, and throughout an officer's career, the amount of things that you're exposed to and have vicarious trauma from is just exponentially compounded year to year to year. And, you know, that does have an effect on officers. And officers need to be aware of how that's affecting them on the job, in their families. You know, that's why the rate of suicide is higher in law enforcement officers than it is in the general population. It's why that they're seeking alcohol or drugs themselves because of the exposure that they've had to. And I think part of dealing with that in a leadership role is providing officers the tools they need and the trainings they need to go to look in the mirror and make sure that they're digesting the information they need to take care of themselves. And, you know, I've been fortunate in my career. I have good outlets in my family that I can talk to, and some officers don't have that. And as leadership in law enforcement, we need to be mindful of that and watching our employees and looking to see if there are issues going on. We've had individuals that work for local departments that have PTSD'd out recently because of the stress of the job, and leadership needs to look towards that and identify those issues when they're happening within their employees and provide them the services they need to cope with the situations that they're involved in. You know, I think that Officers often go throughout a year, they'll respond to suicide calls where you have people that have committed suicide. You'll go to car accidents, you'll go to other violent crime scenes, and that stuff builds up over time and it fills up. A lot of times you go to law enforcement trainings, they talk about you have a bucket, and once that bucket gets full, it starts to overflow, and then your life starts to fall out of control just like everybody else. So I think the big thing on leadership is that being able to watch over your people and be involved with them so that you can identify those issues when they're coming on. But also on the front end of that, we need to provide training so that officers understand how these things can affect them and give them the tools so they can better work on that vicarious trauma so they know what their limitations are, and then they're going to be able to provide a better service to people that are dealing with trauma events or violent events that they respond to.
Well, I think first, being the type of leader that can nurture a relationship to where your officers feel comfortable telling you how they feel is important. Secondly, along with that program I started in Nashwauk where the officers get the free psychological visits, we've also brought in officer wellness training put in by the Minnesota Chiefs of Police Association that teaches, healthy relationships with your wife, being honest with your family, correct diet, exercise to relieve stress. It's all a matter of keeping us well so we can do our jobs.
Dale will be the first person to answer this question. What additional resources do you believe law enforcement needs to assist them in responding and effectively resolving mental health-related calls or issues?
I would say training and a good set of hearing aids. You have to listen. You have to be patient. Most people will tell you, if you're patient, what's going on, what needs to be done. Don't get too aggressive right away. I would definitely send my officers to more training along this line. If I could give them all 6 tons of patience, I would, but it doesn't always work that way. We want to get this done. It's time to go take care of the next call, the next call, the next call. There are a lot of good training outlets around here. There's other people that we can sit down and talk with. Offer counseling to them if need be, if they want it, and just offer different programs along that line to help the officers stay healthy and to stay physically fit and mentally fit.
Can I get the question one more time?
Certainly. What additional resources do you believe law enforcement needs to assist them in responding and effectively resolving mental health-related calls and issues?
Okay. I think the biggest help that we need is to understand and provide information to all the officers in the county so they understand the collaborative resources that we do have available for mental health in our county. I've worked with 211 and crisis response team on a regular basis on calls, and it's not only helped on my professional life but in my personal life. I've worked with people from crisis response. My mother had Alzheimer's disease and we took care of her for the last 10 years of her life, and I spoke with Tom Gaffney in regards to that because of the behavioral issues that she was having, and it wasn't working at the doctor, and he gave great advice and we tried it, and it worked out to where my mom had a lot better lifestyle at that time. I've been to calls where you have other people that are having a mental health issue, and the great thing about crisis response is it used to be where we had to go to the hospital with the individuals, and then crisis response team would come into the hospital and they would do their eval there. Now we can bring people to the 211 office if they don't meet the qualification to hospitalize somebody. Under Minnesota statute, under the 253B statute, where a peace officer has the ability to make a hold on an individual, they have to meet certain criteria, and we have to have probable cause in order to bring that individual into the hospital. Otherwise, we could be sued for violating their civil rights. So an individual has to be a threat to themselves of harm or another person in order to bring them into a hospital. But a lot of times people are just having a difficult day and they need some help. And so having CRT available to come out or bring them to their office or go to a house with law enforcement is a great asset. I've worked with crisis response team members at a house where an individual was having an issue, and sometimes we're able to work things out there and it works out great and they can stay in their home, and other times they are a danger to themselves or they need to go to the hospital. And it's a lot easier to make that decision when you have a trained mental health worker with you versus placing that all on a law enforcement officer that doesn't have that level of training. And so that collaborative resource and letting all of your officers know these are what we have for resources that we can use in the community is just, it can't be understated. You have to provide that training to every individual that's working for the agency so they understand, look, you've got all these resources. It makes your job easier, and you want to make those connections and go out and make those friendships so that you can call CRE at 211 if you have a connection with her. You can call people like Tom Gaffney in the community and ask for assistance and things. And if you don't have those resources available, then you're not doing your job to the best of your ability. And so as in the leadership role, I would provide all officers that training and those connections and get them out to make those relationships and build those resources so they can provide that service to the community.
Sure, I'll read it again. So what additional resources do you believe law enforcement needs to assist them in responding and effectively resolving mental health related calls or issues?
Number one, I think that a great relationship with the stakeholders in our community, NAMI, first call. Secondly, training. And thirdly, I think that we can do a better job recruiting officers and training our officers. Maybe somebody that isn't the person who wants to be the police officer is the best call for this type of call. And we can go out and seek these other individuals and train them to be police officers.
Thank you.
This one is for Joe first. What is your understanding of a plan to enforce the Travis law in Itasca County? This law states residents have a right to request and shall be offered mental health crisis responders rather than police response for mental health crisis calls when deemed appropriate. So what's your understanding of the law?
Well, the Travis law says when appropriate, we'll get people a mental health practitioner rather than police response on a call. I think this is important. I think our dispatch does a real good job. I don't think I think with the CRT team we have in Itasca County, we're not real too far off from being able to implement this. I also think that the relationships we've built with these groups, it's going to work well, and I don't think that police officers need to be going to all these calls, because the last thing we want to do is push someone into a situation that makes them be a danger to themselves or other.
As far as implementing the Travis law, I believe they're working at that now. It's something that's fairly new to the community. They have to notify the proper authorities. Once a person calls and is requesting a service, it's the obligation of the sheriff's office, when appropriate, to notify the proper authority, the property organization, to have them respond, give them the person's information, either get them together or have the organization just go meet them wherever. If I could do it, it would be done on the touch of a button. Once that person calls, that organization would be notified. 20 years ago, I was a field officer, and I had a conversation with Mr. Gaffney here, and wasn't too happy with the situation we had. The organization, the way it was being set up, Now, this is probably one of the best organizations in the state to deal with as far as getting people the help that they need. And I do not see why the sheriff's office would not continue that.
Okay, the Travis Law was passed in 2021, and it was recently implemented in Itasca County Dispatch Center, where we currently have 23 dispatchers, and the law says that you shall provide mental health services to individuals that call that are in crisis or having suicidal ideologies. This incident stemmed from a case in Minnesota, the Travis Law did. It was out of a Minneapolis case, and law enforcement officers responded to an individual that had a firearm, and they ended up killing that individual. And recently in Minnesota, the use of force statute has been rewritten, and so it kind of changes law enforcement's response to suicidal calls, especially with people with weapons or firearms. We are going to respond out to those calls, but we may take longer time and have more conversations about how we're going to go try to make contact with an individual. Is there anybody in the house with that individual that's at risk of being harmed? Are they by themselves? If they're by themselves, there's a lot less exigency to make contact with that person at the time, because we may push them into going through with the suicide. And so the Travis Law mandates that dispatch will relay that information out to the 988 center and get people to those services. But that doesn't mean that because that was relayed to 988 that law enforcement's not going to respond out to these calls, because we are absolutely going to. We're not going to leave our mental health professionals in the dark out on a call with somebody that has a dangerous weapon and let them fend for themselves. That's not our job. Is to go out there and be part of the solution and help wherever we can. And we do that across the board in law enforcement. We help with multiple things that aren't in the law enforcement realm. They're in the civil realm of things that don't fall under our jurisdiction to enforce. But over the years, that has just expanded in law enforcement, and the services that we do provide have increased. And that's part of the essence of community policing and being out there to help your community and be part of your community. But the Travis Law is not a law that was put into place that says that, well, you can do this if you want to. It says you shall issue or get these people in touch with mental health services. And like I said, that did start just this month, and it was a soft deployment, and it's going to take some time to get that implemented in and get everybody on board with the training. But I would be fully behind getting that implemented as quick as we could and providing the training that is needed for the employees of the sheriff's office, so that it is going to work out and be a positive benefit.
Who's that? Julie, you're up. If a person is civilly committed under the 253B statute, what is your understanding of gun ownership and or possession? And how will you bring Itasca County into compliance?
Well, as the chief of Nashwauk, I do permits to purchase for all the citizens of Nashwauk. So when we do a permit to purchase, it does a civil commitment check, and on that, so when that flag comes up, we then are aware we don't issue them the permit. And it also flags to where if they have guns in their home, we have a kind of a deeper conversation with the individual just to see if there are more guns, if he's got a family member he can bring them to, because the last thing we want to do is go in there, act like we're taking them, causing a situation. But I think one of our God-given rights by the Constitution is our right to bear arms. And I'm sensitive about taking someone's guns from them, but I also want to make Itasca County safe as well.
Well, yeah, I believe you have a duty to follow the law, and it would be if the flag pops up there that they have been civilly committed, then you have to go do your job. Have a conversation with the person if they do have a permit to purchase, a permit to carry. they would probably be removed until that party's civil rights have been restored by the court or the other authority. Also a conversation, if you have a family member that you feel safe leaving the rest of your firearms with, ammunition, that kind of stuff. And just making sure that the person is safe, that their family is safe. I believe that's our job, public safety.
Well, I think the big issue on the civil commitment and having firearms is that hopefully the courts are addressing this on a civil commitment, because they should be. Like I said earlier, law enforcement doesn't have the ability to enforce civil orders or a legal authority to do that unless a court addresses or directs us to do that. And so the court should be directing law enforcement to take guns if they have committed somebody and they feel that they're a danger to society. And then we have the ability to go do that. Now, if we're out at a scene or a situation where somebody was suicidal and we're able to talk that person down and get the firearm away from them, we're going to temporarily seize that firearm until they are sent to the hospital, have their evaluation, and if they're put on a 72-hour hold by the doctor and placed in a 72-hour facility, once they are released from that, then they're going to have to come back and request that firearm be back. Now, there are other instances where you would have, say, permit to carry. So the sheriff of the county issues permit to carry. Now, part of that permit says that you can't be chemically dependent or have mental illness where you've been placed into a facility. And so if that's happening and those are learned about, then I think the sheriff has the obligation to revoke that permit until they can provide documentation that they aren't chemically dependent or having a mental ill issue at the time. And but it is a sticky situation on firearm confiscation. This falls down the domestic violence statute as well. A lot of times when somebody is arrested for domestic violence, the judge will say, all right, we want your firearms confiscated. And typically law enforcement's not going to take those into the agency, but they're going to try to find a family member that's willing to take those firearms, because on the back side of that, if we were to confiscate firearms and bring them into the facility and they're damaged in our evidence room, then we're all going to pay for that as taxpayers. And so if somebody had a gun collection and it was a $50,000 gun collection and it was ruined, we're going to be on the hook for that. Where if we can get a family member that has safe access to house those firearms until they're able to possess them again, that would be a road we would go down too. So.
So the second part of the forum is Marion and Tom are going to be walking around to see if anyone has a mental health related question for the candidates that you want answered. So anyone that does raise their hand, Tom and Marion will walk around with the microphone and facilitate that.
Questions? All right, gentlemen, why don't you do
Thanks. I didn't know I was going to be asking a question, but I have a question. So, Mr. Carlson, I liked what you used, vicarious trauma. And that's when an officer, he's basically endangering his own life. And then you talked about having family support, and that's really important. And then I read a statistics where the morbidity rate is increasing. It could be MI, mental illness, could be drug use, and that's increasing. So these officers are more than ever being stressed out. So they got to have a wife or a significant other, or else kick the dog, right? And I think that's real important. I worked for the DNR. We had EAP program, and that was private. We didn't have to, I think you mentioned that, Mr. Dasovich, you go to a counselor, You know, if there's some issue with your wife or your boss, you know, I've been there. EAP, I was a state employee. Anyway, what is my question? I guess the question is this. So if crime is increasing and the officers themselves are being stressed out, you see what I mean? It's but I like the triage by the hospital too, the ER. I mean, it's getting worse, it's not getting better, right? So these officers are subjected to more stress because there's more mental illness, abuse, drug abuse. Is that a question or an answer? I don't know what that is. That's my question.
Okay. Let me see if I can tweeze a question out of there. I think the question has to do with how do we handle increasing crime rates and increasing demands and stress on our officers that are already dealing with some pretty difficult situations. So, and maybe how can we as a community help law enforcement with that? Jeff, do you want to take a start at it?
Yeah, I'll take that. Well, I'll give you a kind of a story about vicarious trauma on myself. So I think that not PTSD, but PTS affects every officer, and it depends on what their exposures are throughout their career. I've done lots of CPR on people throughout my career, hundreds and hundreds and hundreds of times. And my partners know when I work with them, and I let them know right up front that if we have to go to a medical call, I want them to start doing CPR, because I get vicarious trauma or PTS from breaking people's sternum. Drives me crazy. I feel like I get a feeling in my hands like their bones are coming out of their chest and they're poking me in the skin. And so, but once that happens, once their bones are broken or the ribs are separated, then it doesn't bother me to do it. So I think part of dealing with that on the officer side is knowing who you work with, talking about things that you have issues with in law enforcement that maybe your partners don't have an issue with, and they're going to help. Law enforcement is a big family of people. The calls that we go to and the things that we have to deal with when we walk into a building with somebody that has a firearm and we know that they're maybe going to kill us. You have to be able to trust the person that's behind you, and that bond is a lot tighter in law enforcement than I think it is in a lot of professions. And so that's kind of on the law enforcement side, is you need to know what your own limitations are and work with your partners and have the ability to help each other out, because we are a family together and we do look out for each other. And I know there's, you sometimes talk about, there's a brotherhood and they cover things up. And I don't see that across the board, and I haven't seen that across the board. Things that happen in law enforcement, there's investigations that occur, and we have to let that process work through its process. But on the increase in crime rate that we have, a lot of the crime that we do have increasing or mental health that we are dealing with in the community is due to drugs. In the last 10 years, it's exploded in Itasca County. I've been here, I've been working here, and our call numbers on that increase every month, every year, and we go to more and more calls. And everybody in here can walk around wherever they're at in the community, and you can identify people that have had issues with drugs by their body language and what other actions that they're having. And that's created more mental illness. And also off the drug use, drugs is just like, alcohol is a drug. Anytime that somebody uses a drug, it changes their behavior, and they do things that they might not normally do. We have more assaults from that. We have more sex assaults from that. We have more thefts from that. We have more robberies and more violent crime from that. And so as a community, I would say that in order to help with that situation is we want to build those relationships and have that trust, so when things are happening in your neighborhood, we want to know about it. But on the backside of the understanding of is, a lot of times people will come up to me and say, I know they're dealing drugs out of that house. And we might already know they're dealing drugs out of that house, but we need to have the information that proves they're dealing drugs out of that house to get a search warrant or to make an arrest. So we need, as citizens, we want you to be mindful and watchful of what's going on and give us information that can be helpful, in the process to that. But that's part of the community policing value system that I'm promoting in my campaign, because I want to have those relationships developed, and you deserve to know who the officers are, and the officers deserve to know you all, and build those relationships, and we can get better at it. So that's my answer to that.
Joseph?
Could you kind of reread it?
Okay. Let me see if I can do that. So we know that crime rates are increasing, and that's making it more of a challenge for officers who are already under considerable stress, and there are fewer officers now. So what do you see being able to kind of cope with that or prevent that, and what can the community do to help with that as well?
Well, one thing that works well, I've noticed being a firefighter and a police officer and running the Nashwauk ambulances, my employees, they benefit from debriefs. We have the SISM team come in and do a debrief on bad calls, and it gives them time to tell their story, decompress, kind of just have another person that was on the call and be able to talk to them. It's worked well. I've sat in on 3 of them myself in the last year, and it does do wonders. Another thing I think we can do is we can change the schedule to have more officers on when times are busier. I think looking at that can also alleviate overtime and alleviate burnout, because not all of you know this, but cops love overtime, and we're always going to work it, and we're going to burn ourselves out, and we're not even going to know it. So we got to know ourselves to better protect ourselves too, and I think that's kind of the first step in all of it.
Yeah, the drug problem is probably the biggest crisis now facing our community. Talking to the officers on the street, they spend pretty much the whole shift dealing with drug crimes. A lot of the other stuff has to go by the wayside. We've been fighting the drug crime since Al Capone days, and we just don't seem to be making much headway. It just keeps the snowballing. We all have to stand together. We all have to fight. This is our community. We're not going to let it take over our community. If we see something that's not right, we're going to call the proper authorities. We need your help as much as you need our help. We're a team, and we're in this together. We're your friend. We want you to know that our officers are there for you, fighting for you. 2 o'clock, 3 o'clock, 6 o'clock in the morning, they're out there keeping your neighborhood safe to the best of their ability. Sometimes it's not easy. They get short-staffed. Officers do choose to leave the department, and we wind up 10 deputies short for whatever reason. The staffing now is getting back up to par. That 10 deputies short meant extra overtime and extra burnout for the other officers that now are probably not liking their job so well. Trying to recruit from different areas, maybe different states even, putting ads out there that we are hiring. We want to put you on our staff. We're looking for dedicated people. Maybe not so much trained, seasoned officers, but young officers that we can kind of train the way that we want them. God doesn't call the qualified, He qualifies the called. There are good programs out there to help us keep our community safe. The officers also seem to be getting just overwhelmed with paperwork. Simple traffic stops, and then they're doing paperwork. Severe or major drug crimes, they just get overwhelmed with paperwork. There's got to be some way to maybe alleviate that, or you don't have to send 15 copies of this report out to these different agencies. Different programs like that could help alleviate some of the stress on our officers and our community.
Hi there. Sorry, louder than I thought. My name is Michelle Gross, and I'm actually the author of Travis's Law. And I wanted to just, first of all, I want to say thank you for this forum. It's an excellent forum, and I'm very impressed that you have all these answers, and that all the candidates are here to respond, and your answers are deep and thoughtful. But I wanted to give a couple corrections to what you're saying about Travis's Law. First of all, Travis's Law was implemented in September of 2021, and it was based on the death of a man named Travis Jordan who did not have a firearm. firearm. So I wanted to correct you on that. And in fact, I think it's important because less than 1% of mental health crisis calls involve any risk or danger. And so the purpose of Travis's law was actually to enable mental health crisis responders to go to calls on their own and thus relieve law enforcement of having to attend to those calls when you have so many other things on your plate and so many other, areas that call for your attention. And so, I would encourage you to fully implement Travis's law such that you don't have to be at every one of these calls. The idea is that we are expanding the response network so that we don't have just fire, police and ambulance, that we have mental health response, that we have other kinds of response to different crises, and so that you're not, again, having your time taken up for things that don't necessarily require your response. I do want to point out one other error, and that was that all of you said that Travis's law requires mental health crisis response when appropriate. That's not the language. The language is where available, and that was on purpose. That was negotiated with the legislature because we wanted to say that pretty much most of the time, mental health crisis responders should be the primary response for those calls, and only in times when they're not available, because it's a large county in some places and people can't get everywhere, and sometimes there's staffing shortages. We wanted to recognize that and not, hamstring people. But at the same time, we think that most of those calls are in fact appropriate, and when it's not appropriate for just a mental health crisis response, there should be a co-response. Law enforcement and mental health crisis together. And so I just wanted to throw that out, but again, I wanted to thank you all for your thoughtful responses.
Thank you.
I don't think I can summarize that in a question, but thank you for sharing that.
Yeah, the question that I wanted to ask is, first and foremost, I'm a mom, and so I have several children, and so while we're talking about mental health tonight, one of the biggest crises we have, I'm sorry, I lost a friend this week from suicide, so I'm going to hold myself together the best I can. It's a young friend, actually, a juvenile, and so what I wanted to ask is, how is the county working and implementing within our school systems, and what is the plan to do more in that department as far as working with the local law enforcement as well as the county to be able to make sure that we're addressing mental health issues that are happening right here in our juvenile population as well?
You want to take that, Joe?
Yeah, so because of an officer shortage I've had this year, I've spent some time as the school resource officer in Nashwauk, and I've been able to see the kids. They're provided North Homes support. We have some crisis intervention stuff that's available, but it's never enough. There's an increasing population of people that have that need help from just organizations that are willing to provide it, and I think as sheriff, we need to foster these relationships to make them better and more available for our kids. And school may be the only safe place some of these kids have. And I think that's important that we recognize that.
Yeah, there are school resource officers in some of the schools around here, and just letting the kids know that they have an open door. I mean, I'm sure that school resource officer would be more than willing to talk to the person about whatever it is. Developing a relationship and making sure there's good school counselors in place. Maybe making a connection through First Call for Help and I'm sure there's staff available that would be more than happy to respond to the schools if there is any issues. After school programs are big. Sports is a good way to stay healthy. Get the kids, the people out involved with other people to get them to enjoy the most regular life that they can, and just get them to be around people. Sports, whatever. If it's the ground floor now that closed, I'm not sure if it's reopening or not, but another facility like that to have young adults be able to gather and have a nice relationship.
I think that you have some programs in school. You have the DARE program, and then I spoke on a different forum about the Let's Chat program that they currently do have in Itasca County, where they meet with 7th grade kids and work on relationship and just self-esteem issues. And I also talked about wanting to go back in the high school and speak with the kids again, and because that's when the peer pressures kind of develop in their life, whether it's dating or whatever else that is. So I would like to increase that collaboration and make that connection. You know, we do have school resource officers in a couple of the schools, and they are a good resource that we have, but you know, they are busy doing other things when they're at the schools as well. So I think there needs to be more collaborative efforts and working. But there are programs in the community that are working with the kids, but we can do more. And I think the programs, especially in the high school, because we do have one of the highest rates of suicide in the state in Itasca County for kids under 18. And we need to work towards that. And part of that is being a good friend, whether you're in school. Part of that's, if you're a parent, being more mindful of what's going on with your kids. I've raised 2 kids myself, and you know, kids have issues just like when we grew up when we were kids, and you have to be mindful and make sure you're paying attention to that. But I think advocating more contact with the kids again in high school when those pressures do develop is a great asset that we could implement in the community and work with the school districts and the teachers to get them on board with that. So.
So my question is going back to the therapy that is available to police officers. How will you use the trauma treatment contract the county has to ensure that your staff are dealing with their own trauma before trying to engage with community members?
Could you read that one more time, Mary? I didn't catch that.
How will you use the trauma treatment contract that the county has to ensure your staff are dealing with their own trauma before trying to engage with community members?
I recently saw Grand Rapids Police Department contracted with Breitbarth. It's a private organization for counseling, chaplaincy and counseling. If the contract is there, if the people feel that they need help, I would have an open door policy. I would try and have the best relationship that I could with all of my staff to make sure, and the staff under me and around them, that they would know that if they need some of these services, number one, they would know where to get it, and that they would be able to confidentially and freely come and talk to us about what's going on. If they need time, they're going to get all the time they need to get healthy. Sometimes that may take a while, but I would definitely utilize the contract.
I think that the contract is a great thing to have out there, but I think the skepticism on the officer's end, at least when it did happen at Grand Rapids, was there was concern that if they did bring something forward that would affect their job and the employer's given them this opportunity, even though they said it was supposed to be, you know, everything that was said was not going to get passed on to the employer, there was skepticism on their part. I think that we need to be able to offer a service out that the employer doesn't have direct contact with whoever that counselor is, because they're never going to feel comfortable coming forward otherwise, and they're not going to come out and say, hey, I'm struggling with this. And so I think that the contract is good, but it needs to be redone so it takes off that weight off their shoulder. And I understand why cities are doing it because of all the PTSD retirements that they're going through right now, and it's costing a lot of money to the taxpayers. But if you want to get an officer to open up, it needs to be where they really feel like it's confidential and they don't have any worry about repercussions from it.
I'm fine with the contract. It's just that we ran into officer hesitation too in Nashwauk, so we made it so it's 6 visits and they can go anywhere they want because they may have relationships built with mental health practitioners already, and we didn't want to dictate where or when or how they could go.
My name is John, and I was just wondering, is an officer required to handcuff someone who's having a mental disability right away? Definitely two set of handcuffs if the person, if needed? Because that's what happened to me with a seizure. I was placed in 2 set of handcuffs by a city officer, and I was wondering if that's required to be done to someone with a medical disability like myself.
I believe the answer would be typically no, unless someone else is in jeopardy of being harmed, like the officer, people around them. Otherwise, just because a person is having a medical episode, no, there would be no reason to handcuff them. Otherwise, it would be for the safety of that person, for the safety of the people around them, including the officer.
Yeah, I would say in this case, if it is a medical issue, the only reason that handcuffs would be used is if the officer thought that they needed to do that in order to protect the person from harming themselves or others. So that would be the reason.
I agree. The answer is no, and I'm also an emergency responder, so I would go into medical care mode in that situation and protect you during your seizure from further harm.
I'm wondering, I'm wondering if you guys have considered putting either crisis response team members or social workers in squads with your officers if you are elected.
Yeah, I would consider doing that. I don't think that that's at this point with a staffing level that they could do that 24/7. But I have had crisis team members ride with me before. I've had advocates ride with me before, and other officers in the department are as well. So we're definitely open to ride-alongs, and I'd be open to that as the sheriff to have mental health workers riding with a deputy, especially when we know it's a mental health call that they can go out and have that interaction with.
I'm very open to the idea of it as well. I think that at the very least, it's going to build a bond, trust between us and the crisis response team. Yeah.
My answer would be yes to an occasional ride-along, but no on the other portion. There's a lot of things to be considered. Safety of everyone involved. Safety of the mental health person. Now say that mental health person is with me. Oh, now we have to go to a shooting. That person is unarmed. They're just going to have to sit there and wait till this is taken care of. But possibly on a short term, maybe on occasion ride along, but on a permanent basis, I would say no. It's they are a valuable asset to have on our tool belt. We need that tool on our tool belt. But there are so many other things that we do that my answer would be no, just for the safety of everyone involved.
So currently, the Sheriff's Department has a dedicated officer that sits with the child protection team and goes directly with the social workers to calls that involve mental health concerns, chemical dependency concerns. Is it your plan to continue that arrangement?
Yes, I think that's a great position. I think the officer is very valuable in it. And if you look at numbers, the incidents that officer handles justifies that position. Yeah, it's a no-brainer for me.
My answer is yes. I believe we need certain dedicated positions in this county and throughout the community, and that's one of them. Domestic abuse officer investigations, that would be another one. Dedicated drug investigators, would be another position that would be there, and that would be their job. But that would be a position that I would definitely bolster and make it as good as I could, because it would help everyone.
Yes, I'd be in favor of continuing that program. I think social services is an invaluable asset, in child protection and the information that officers sometimes need when they're on a call with a family, and we may not have had exposure to them on a regular basis, and so we don't know what the background is with the family, and so I often call social services or child protection for that information. But having them come along is even better, because you can work with them, have better implementation of the process. If there's a child hold in place or other things where they're maybe doing UAs for social services, and not only are you there helping out and learning more about that situation that could tie law enforcement into it, but you also have the camaraderie and the relationship building and the safety together as well.
It was identified that there's like high burnout, PTSD, depression happening within officers, but then later it was identified that culturally within officers, they won't ask for help. I want to know what the plan is to change that culture if you were in leadership, because I think that it has to be okay for an officer to utilize the help that's offered to them.
Number one, an open door policy, completely confidential. Different programs throughout the county, like the one Officer Dasovich implemented, a great program. These officers would be available to utilize any place that they wanted to. The critical incident debriefings and defusings after the events, very, very important to get that off their chest right away. Everyone involved, sit down and talk about what happened. First call for help, hospital staff, firemen, officers. The sheriff probably would not be there, though, because the sheriff was not involved in that incident. But other first responders would all be involved. They can talk openly about what happened. The one defusing that I was involved in, an officer did not realize he was acting that way until his peers brought it up and told him about it. Well, it can be very beneficial the next time that officer goes to a call. It also helps vent. Officers have a very, very built-in habit, I'm going to say, to sit down with each other, we talk with each other, we laugh, we joke, not in the way normal citizens do, but it's kind of on the other side of the blue curtain, I'm going to say. It's not always completely affected. We need other programs like the one Officer Dasovich has, the ones Grand Rapids PD has implemented, but there is that stigma there that they're going to tell our boss what's going on in our life, and that's not true, and that needs to be able to, we need to be able to remove that from the system.
I don't think that you're ever going to get rid of that in law enforcement, because the exposure to calls that we go to, and that's just never going to change. I think part of being able to deal with that is having good outlets, continuing educating yourself about what these issues are on the mental health level so that you can identify them yourself. And then on a leadership level, though, is providing that training out to the officers to make sure that they are aware of this and they do have the resources they need to identify if they're having problems. And it changes throughout your career, and you have to be aware of it. And then also having good partners and coworkers, so they're looking out for each other as well. And I think that's part of building the team, so everybody is working as a team and looking out for each other.
Along with what they've added, I think there is some tough decision in this. Is right away is you'd have to look at the schedule and change it, so you may have to be the bad guy in the situation and change the schedule to make it not so easy for these officers to burn themselves out and be able to recognize it. And another thing is just fostering a good relationship with your employees.
One question down
I believe Mr. Carlson kind of touched on this a little bit, but I was kind of curious about community policing and its role in reducing recidivism and how you would implement programs and the funding of that, and if you would hire more officers to help in that.
Okay. The great thing about community policing is it doesn't cost you anything. It just costs you your time to get out there. And there is an overtime issue that has been ongoing in Itasca County for quite some time. The overtime rate 2019 was like $525,000 roughly dollars for 28 road deputies. If you compare that to the agency that I currently work for with 20 officers, our overtime budget was $85,000 roughly, somewhere in there. So if you're paying that much in overtime, you could be where you're going to hire more officers and you won't have as much overtime available. And you can also change some of that through scheduling and not on the times, because there are certain times of the day where we're not as busy and we don't need as many officers working. But if you look across Itasca County, of the 3,000 square miles, typically you have 4 to 6 deputies working in that 3,000 square mile area. And so there's a lot of area to cover. And when calls come in, if there's a serious call, if you have a domestic assault that's going on in Cohasset and you have a domestic assault that comes out north of Nashwauk, safely you need to have 2 officers at each one of those locations so that we don't have an officer injured or we don't have somebody else injured. I'm trying to remember the other part of your question as far as... Okay, yeah, and I've talked about this before, that I kind of have a program thought up in my head is Coffee with a Cop is what I've kind of called it, and I want to get out to the townships, every township in the county on a quarterly basis, myself, the deputies, the chief deputy, and making contacts with people and finding out what's going on in your neighborhoods that is an issue for you and what we're doing good or what we're not doing good for you, because it is your sheriff's office and we want to be doing the services that we can do for you. We want to work for you. And if we're not doing the right thing, we want to find out. And what they need in one township is not what they need in a different township, because things change like that. And so that's a culture that needs to be built within an agency to develop those relationships and grow that out. And it needs to be kind of an essence that the officers understand that that's what their work is about. It's about the people. It's not necessarily about that call they're going to. It's about helping the community and being part of the community.
So I think we've done a great job with that in Nashwauk, where our officers' mentality is we're part of the community. We don't act like we're better than anyone we police. And that's my mentality. It's why I've always had an easy time implementing everything with community policing, is just because I'm going to talk to the person I'm dealing with like a regular person. And I also think that part of this is the sheriff needs to be the most visible person in all of government in Itasca County. And as sheriff, I plan to attend almost tirelessly on public events. And I think that'll go down through the ranks.
Well, I think the DARE program is a great place to start. You have, I'm not sure how exactly how many DARE officers are in the sheriff's office right now. They go and meet these kids. I would encourage these officers to develop a good relationship with them kids, other than just going there, teaching a lesson and leaving. I would want that child to go home and say, hey, Mom, Dad, we met this nice officer today. He says you can talk to him anytime if you'd like to. That would be one place I would start. Town halls, I would go as myself as the sheriff. I would make sure that every township in this county knew when they saw one of my deputies, they were their friend. Community policing does work. Going to different events like the home shows throughout the county, setting up booths. The Itasca County Fair is a great place to meet people, to meet your officers. If the officers would like to work there, they wouldn't be forced to do it, but it would be open for them to do so. If they wanted to go to any parade in the county and just go chat with the people, work with the people, and just go out and be visible in the public. 9 times out of 10, these officers work at, not 9 times out of 10, but they work at night when most people are at home sleeping safe in their beds. That's half of their shift, half of their duty. During the day, they are busy taking care of other calls, no matter what it would be. We'd have to try and develop an open door policy where the public and the public would feel that they could just approach one of my officers anytime they wanted and talk with them.
Hi, I'm Lori, and I have counseled like a lot of children that have been through trauma. Part of their trauma was like seeing their mom and dad get arrested or thrown in a police car from obviously a policeman, and they're all, decked out in their uniform and badge. So that is part of their trauma. So that relationship, I just wanted to add, that is so important. Do the police officers have that in mind? They might be defensive and not want to, or be scared of talking to the police, that they're not safe. Or they might take my mommy and daddy away. That makes sense.
I think that's...
So to try to summarize it, it sounds like she's wondering what kind of trauma interventions you would institute for officers and awareness of how the family members are possibly traumatized.
Yeah, I think overall law enforcement officers, when they are on a call, whether there's a child involved and somebody is arrested, try not to do that around the parent, because I wouldn't want my kids to see that, and I know that's a traumatic event. I think that the majority of people are aware of that. Some situations dictate where we don't have a choice in how that happens, but I definitely wouldn't be opposed to having a training to talk to that fact of, hey, make sure you're being aware of this so we don't have it happening more frequently than we need to, because some situations, like I said, you just can't get out of. But
early in my career, I was in the school reading Dr. Seuss to the kids, and one of the kids goes, "Hey, I know you arrested so-and-so," and it changed the way I police with kids present from then on. And when appropriate, I will always use my verbal skills, maybe talk to the parent that's getting arrested and say, "Hey, can we walk out to my car just normal? We got to do this." And I just try to build that rapport with them ahead of time. And I'd say the majority, they don't want to do that in front of their kid either and push a situation, and I don't either. And I think it's a mentality shift that law enforcement needs, where we're not the tough guy on a scene and you're going to do what we say, but we're going to use our verbal skills and build that rapport and advance these situations healthier.
Yeah, early in my career also, I arrested a man, he was my age at that time, domestic assault. We got in a little tussle, out to the car we go, and I see him the next day and he's very offended, very offended. He ended up in front of the judge, got out. "What's the issue, sir? You did that in front of my children." "You know what, sir, I never thought about it. My mistake." One of them children now is a Grand Rapids police officer. But you learn through your career, don't act that way. Children are there, people are watching. Be aware of these children. Another incident I had, we found a set of keys. I take the keys back, lady comes to the door, gets the keys. I'm sitting in my car doing my report, and I hear a bang on the passenger door of my car, and there stands a young man with a bow. He shot an arrow at me. I got out, and what's going on? "You're not taking my daddy to jail." "No, that's not why I'm here." And she came out. That trauma does stick in their minds, so we just need to train the officers, be aware of who's around. Like Officer Dasovich said, if we're able to do this outside, let's walk outside like adults We don't have, but we do have a job to do also. Don't try and change the train of thought on that. But try and do it in a gentlemanly-like or ladylike fashion, out of the eyesight of the young eyes. Training for the officers, it's just about being aware of your surroundings and trying not to make the same mistakes I did when I was out there.
Thank you for being here, gentlemen. It's a very good forum. In 2018, I had a very traumatic incident and calling 211 and the police department, and it really had long-term traumatic effects on my family. We were really not helped at all. With Travis's law, I believe that would have ended very, very differently. Thank you for the author of Travis's law for clarifying that it's not when appropriate. I was worried that somebody would be in charge of deciding what was and wasn't appropriate, but instead it says when available. That being said, my question is there a specific crisis team that will train and be available to be dispatched to these situations, and how will you implement that?
I plan to use our current crisis response team and work with them to help them better deploy out to the field. And if they ask me, I'll provide whatever resources they need.
Yeah, as I stated before, I believe we now have one of the best crisis response teams and formats available to the public in the state of Minnesota. It can always be made better. We can always equip officers better. We can always equip the first responders better. The mental health professionals can always be made more aware of what we as officers need. We can always be made more aware of what they need on the other end. And we'll work together and do the best job we can for the people that we serve.
Yeah, I would say that I would continue on with the crisis response team. It's a great organization. It's the largest call center in the state of Minnesota right now. It services 38 counties. They currently have 56 employees, and there's 29 CRT members right now for crisis response. So that's who I would utilize. It's already set into place in the county. We already have a collaborative network working with them, and I think that they've built relationships with the community as well, and they're able to provide that service better as well, just being that they're already implemented in the community. So.
I don't so much have a question as a recommendation, and I don't know if it bodes well for me or poorly for me, but most of my friends, my dear friends, work in social services in Itasca County, and to a person, each one of them has told me that when they've responded to a situation, they have officers that they prefer to have by their sides. And I guess my recommendation to whomever becomes the next sheriff of the county, and I hope they're sitting in front of me here, is to, you know what's going on in your organizations, and you have hopefully you will have a really good hand on what's going on. I would suggest that you observe who has already developed rapport with people who are in the social service areas of the county. Seek those people out and see just exactly how they develop that rapport, what attributes they feel they have that make those people feel comfortable, so that not only are you being supported by them, but hopefully you'll reach out and get to know those folks that already have those rapports, and kind of do a best practices with the rest of your folks to spread the wealth of commitment that those officers already have. And thank you so much for being here.
Thank you for the advice. Thank you much.
My response to that would be, I think that those are great remarks. The other thing in law enforcement that I believe is really important, and I've seen work throughout my career, is that field training programs that are implemented by departments when they hire new officers. If you train an officer poorly or you train an officer not to do anything, they're going to do nothing the rest of their career. You want those people that have those good relationships and that good rapport to be your informal leaders and your field training officers in a department, because they're going to put forth that effort and get that information passed on, those skills passed on to people. So I think that's something that is really important that you need to look at taking over as sheriff, is finding out who those informal leaders are and who those people are that are doing that good quality work, and making sure those are the people that are training the new individuals that you hire into your department.
I want to be able to have the relationship with the staff up there to where they would tell me, hey, this is who we want, this is who we're comfortable with, and I can appoint the right officer in the right position.
Yeah, the field training officer is a big one. I've seen some appointments that, not the best appointment for field training officer. You want someone that is going to be good with the public, that's going to show them the right and proper way to get everything done. Very important. People do have bad days. Sometimes officers are people. Sometimes it just happen, okay, I'm having a bad day, I just happen to deal with that person on my bad day. Trying to get officers to have as few bad days in their career as possible, and to just try and manage the department to help promote all programs and all officers to deal with the public in a very professional and very orderly fashion.
Okay, I have a two-part question. The first part being, what, if anything, do you know about the restoration to competency process following a court-ordered commitment? The second part to that, how, if at all, do you feel law enforcement should be involved in that process?
Well, it sounds like it's a court-ordered process. That is something that would be followed by Human Services. It would be followed by the courts. I'm sure there would be hearings, follow-up hearings. There would probably be attorneys appointed on both sides. If law enforcement needs to intervene to do welfare checks, or to just basically make sure that everyone involved is safe, I believe we should be involved if needed.
Okay, I know it's a newer program, and it's a community-based program where people that are under commitment and aren't able to go before the court and face whatever criminal charges they have against them are worked with. And instead of doing a hospital-based service, which is a lot more expensive, like $100,000, versus a community-based where you're working with resources locally that have been developed within the county, it's about $3,500 per person versus $100,000 per person. And there's a waiting list right now within the county. There's about 50 people on a waiting list, and it's a newer program that's being developed and currently being implemented. And July 1st, the Rule 25s went away for CD vals, and it depends on who is actually dealing with the commitments, whether it's an MI only and it's mental health providers, or it's a CD MI and then it falls under different providers as well. So, but it is a program that works for individuals that are in jail but not able to go before the judge and deal with whatever criminal charges they have until they are meet the competency level where they can do that. So,
as sheriff, I would assist the staff in the court and jail with that court order, and I would just be a resource for them.
Hi, my name's Adrienne, and I'm really glad that the three of you are here tonight. Thank you.
Earlier, another individual had brought up the conflicting hesitancy from the officers that are hesitant about seeking mental health support. And all three of you have said that you want to provide mental health support. So I'd like to know what makes each of you the best person to be the head of that department, and what are the behaviors or the different things that you're doing to take care of your own mental health? How are you leading by example? Because hurt people hurt people. So how are you taking care of those people who are then taking care of the citizens? Thank you.
We lost track of who was up first. I think that in my own life, I've had good outlets. I have a good family outlet that I've been able to deal with whatever issues I have. And I think part of getting better at that is understanding what your weaknesses are and continue to educate yourself on how to deal with those issues. I think as being the sheriff of the county, I think leadership skills matter. I think experience matters when dealing with these issues and things that you've been exposed to, because it gives you a lot more qualifications on how to help and be part of the solution of whatever the issue is. And I think that myself, having the 15 years leadership experience that I've had in a larger department, has exposed me to a lot more events in law enforcement that gives me a lot better ability to work with people and say, yeah, I can help out with this, and we need to identify these leaders to be at this spot, and also the collaborative efforts that I've been able to develop over the time in law enforcement, the relationships that I've built. I think that helps build that base of knowledge of where we need to go as far as we have these people to work with and we have these resources that we need to use, and it's a benefit if we do that. And if we don't have that knowledge base out there, if you can't get that out as the sheriff, then you're defeating the purpose and you're not providing the resources that you can to the community.
So out of all the candidates, I've implemented the program, and I feel like it's successful in Nashwauk, and we've had officers that have used it. I've used it myself. And part of it's just being vulnerable and honest with your employees and being that leader that, hey, they can come up and talk to and tell you when they need it. And I think that's important.
Well, I guess to start with, if I knew one of my officers was hurting somebody, I would go have a private conversation with them. I wouldn't get on the radio, hey, come see me. I would privately go and talk with that person, something going on. These services are available. If it's something we need to deal with farther, we will deal with it privately. You have that option. If you choose not to use these services, if you continue to hurt people, as sheriff, I have to protect the community from the evil from within inside the department, if it's there. That is also my responsibility. I would say that most officers want to be healthy. They want to be happy. And if it was there, if they knew they could use it confidentially, they would. Myself, how do I keep myself healthy? I try and have a proper diet. I'm not the best at exercise, but I do. Being a Christian, I spend time in prayer and meditation with the Father. And I also spend time talking to friends and family if I need to, and my wife, Melody.
First of all, I want to say that there was some talk of teen resources teens can reach out to, and I think it's really important to have outreach programs for teens, because that would mean people reaching out to teens as opposed to the teens only accessing those resources by reaching out themselves, because many of them won't. And another comment was that the parents have a role to play, and I want to just point out that many teens do not have parents who are equipped to deal with mental health issues, just to clarify that. But my question is kind of for Mr. Kaiser, but for everybody. And Mr. Kaiser, in I think it was 2015, you published an official letter advocating for a national day of prayer, well, a day of prayer for Itasca County emergency responders. And in that letter, you quoted the Bible, and you said the only answer a country has is God. And while I think there is a place for basic religious counseling in church settings, it's my belief that specialized trained mental health professionals are best equipped to deal with mental health crises. So I wanted to know, what role do your religious beliefs play in mental health crises, and what role do religious-based interventions play?
As a Christian, I'm not religious. I'll point that out to you. I believe in God. I believe God is the answer to a lot of our problems, our issues. We, as people, fail to acknowledge that relationship that the Father wants to have with us and that we should have with Him. There is a spot, and I'm not denying that mental health personnel are needed. Everybody has a day when they need to talk to people. There's a lot of people, even Christians, that just desire and would like to go talk to counselors. I feel they're a big part in our community. As I've stated, our first call for help is one of the best in Minnesota. The day of prayer, I'm the chaplain for the Itasca County Sheriff's Office employees. I have never, ever, ever pushed my faith on anyone else. If someone wants to talk to me, they talk to me because they know me. They know that I'm a chaplain, and they know what they talk to me about stays here. There's a National Day of Prayer where we get together at the courthouse and we pray for our country. This was a vigil that I had at the sheriff approved it, and he supported it, to just sit down and pray for the first responders, to pray for our country, to pray for the law enforcement officers, and to just pray for the system. But as far as me pushing my faith on anyone, no. But if they desire to have a conversation with me about my faith, I will do so. But as I stated, first responders are a big part of that. They are needed in the system that we have. Thank you. Thank you for the question.
Just having a program out to speak to kids about whatever the issues they're having in the schools, I think that you need to address that. I think I went over that earlier about having that engagement, because I do think that it provides a positive engagement service for them that can help them in the future. So
we've, first off, just the religious side of things, I would only encourage that if the person was asking for it. Other side, our school resource officer position, we write a grant for that, and we have to put goals and marks in there on what we want to hit. And we wrote our grant, and not in any part of that does it say the SRO as an enforcer. It's the SRO as a mentor, the SRO as a teacher, the SRO as a team builder. So we've implemented that in the school in Nashwauk-Keewatin.
As a visually impaired citizen, communication is extremely important to me. If there is a controversial or questionable interaction between any of your officers and somebody having a bout of mental disability, what would you direct your department to do with regards to communicating that with the community, and how would you respond to community engagement with your office if it is questionable?
I think transparency is key when there's anything questionable. I think the sheriff needs to explain the situation. And as far as dealing with people that are verbal, nonverbal, sight impaired, anything like that, I think patience is key in that. I don't think we should go to any situation pushing the call. We need to be prepared to show up and listen, but keep it, make sure the scene is safe. But the last thing we want to do is come in and force anything, or I've been a cop long enough. I've dealt with all spectrum of
disorders, and I have this kid in my community who's authority defiant, and he's not afraid to tell it right away, and I think it's all about communication. He communicates that, and I communicate what I need, and we just find a nice end goal.
And I believe if there was a legitimate complaint against someone, we have internal investigators to investigate that. If it needed to be outsourced to an outside agency to have it investigated, there's only certain things that at that time that can be released to the public. After the incident was resolved, then the public could be made and would be made fully aware of what happened. And I just pray that it never happens.
Yeah, if there's I'm guessing that you're talking a use of force incident. Is that what you're?
It can be related to that. That can be one example.
Okay. Yeah, just being able to talk to people and work with them on a slower basis so you don't cause confrontation, I think is great training to have, where you're de-escalating a situation and you're not walking in and causing further problems from happening. But if there is an issue like that, then I would want to fully investigate that and come to a conclusion of what happens, so that if there was an inappropriate behavior, you would have whatever disciplinary action that you would have to do, and then retrain so you don't have that issues in the future.
Was there a question up in the top row?
Thank you. The great forum. Thank you. I totally appreciate our local law enforcement work closely with a lot of them, and have good relationships with many. One thing that's always struck me as a bit of a, well, I think we'd all agree that any police department or law enforcement department is better able to, the more diverse it is, the better it is able to represent the community it serves. One thing that's just struck me locally is with the sheriff's department, in the years I've been around, there's been almost no female patrol deputies. But that seems, for a department of that size, just fairly unusual, and not blaming anyone there. Just wondering if there's a concern about that from any of you, and if you have any plans to do anything about that. Thanks.
I think that's a big deal, and I think we need to work on recruiting those individuals.
I believe, without any respect to gender, race, religion, creed, we need to put the best person for the job in that position. That would be my priority in hiring. I don't care who they are. If they're the most qualified, that would be the person that I would appoint. As far as applicants, I don't think there's been a ton. There have been female applicants to the sheriff's office. But as far as I know, Wanda Bunis, she was a deputy on the road. We have several female jailers. We have several female dispatchers. And of course, clerical staff. And search and rescue staff. But I would hire without regard to any of the above, the best person for the job.
I spoke about this in a different form, where I do think that it's not a great thing that we haven't had a female deputy in a long time. Every department I've ever worked for has had female officers, and I think they're a great resource to an agency. I think they bring a lot to the table, and they do the good job just as good as a male person. And I think that that's something we should, use. My plan is to hire females if elected as a sheriff.
So being that a lot of the mental health crises and crimes are related to drug abuse, what, if any, resources and services do you have planned to offer clients that are in jail?
I believe we have to get back to corrections. It seems like it's been turned into a housing facility. Just look at what's being built there now. There are many, many programs that could be implemented inside the jail. A greater majority of their time, they just kind of sit in their cell. The work release is a great program. Go out and work for the community. You get some time off your sentence, possibly learn a trade. It's been suggested in the past about a work farm. If the county had a spot of property, they could start a farm, raise vegetables, raise cattle, provide a service to the community, also maybe provide some of the food for the jail. You have to have staff to run that, though. I would not be at all against any mental health counselor that wanted to come into the jail and speak with anyone on a basis, if they wanted to run a program along the lines of Celebrate Recovery or something like that. If they were a trained and qualified mental health professional, they're good for the inmates. They're good for everybody. It helps them know that they're cared about and they're not just being put there to be removed from society for a time frame. But it has to get back to corrections. Now I think it seems like it's just a place to house people.
Treatment in the jails, they currently have treatment that they are providing in the jail, and I think that I would continue on with that. The drug issue is a huge epidemic that we do have in the county, and if you don't provide treatment on the back end of after incarceration, you're just going to go back to the same revolving door. And so we need to work on those programs that we do have and continue to collaborate and build upon those to make improvements, and so we do have success in the end.
I'd also build on the current programs that we have. The new jail does have the space, and we need to, as leaders of Itasca County, we need to look at recidivism and deterrence from crime and really take a close look at what other programs could work for our citizens.
One more question. If you look at Travis's law, it says that the crisis team will be called, quote, at the discretion of the public agency operating the public safety answering point. Will there be specific training for dispatch to identify what a mental crisis is?
Yes, I plan on providing training to that. Dispatchers, just like road officers, need to have the training necessary to understand what their duties are and carry out those duties effectively.
I also think training is a necessity for this, but I think CRT should be driving the bus on the training so our dispatchers get it from their perspective and not from law enforcement perspective.
Yeah, I think they should be trained together, both the CRT staff and the dispatchers, the road officers, the jailers, the clerical, all be trained together so they're all aware of what Travis law is, number one, and what our responsibility is, and how we can make the best service possible for everybody. It's better off to call someone than not.
So I believe Craig kind of touched on this question earlier. I was more curious with civil commitments and firearms. I know Mr. Dasovich kind of spoke on wanting to protect people's gun rights and everything. With civil commitments, though, the law does state that they cannot have firearms in their possession. So what I'm curious is, instead of a lot of the answers that were previously answered were kind of more towards purchasing a new firearm. I'm more curious about what's going to happen with the firearms that have already been purchased and what your process would be with that.
So I'd I've dealt with this a few times, and I always give the person an out to give it to a family member. Then their guns are in their possession. There have been times where I've taken them into the police department in our evidence room and secured them. We don't typically like to do that, but I would much rather have it be with somebody that they're in control of, so we're not in control of their property.
Yes, I would also much rather give it to a family member. As the law enforcement authority, once that happens, I believe you have the duty to revoke the permit to purchase and to revoke the permit to carry. Make sure that the person is aware of that, and make sure that if he does not surrender his firearms in a voluntary manner, then we will be forced to take them. But most people, I think, would comply. If we're going to let you give them to a friend or a family member, not everybody will. No, don't get me wrong, not everybody will. But most people will say, okay, I'm going to give them to my best friend rather than take the chance of being found with them and going to jail.
Yeah, I would just go back to the answer that I talked about before, that I would try to get an alternate person to take them. It's not very often that law enforcement does take them into custody because of the liability they bring on, but same as answer that I gave before.
One more question. One more question.
I know there's been some discussion, and mostly negative, about the new jail, but I'm wondering how long it will take the new sheriff to come up to speed with the programming that will be in the new pods, and the fact that each pod will have conference rooms for Rule 20s and Rule 25s, and the resources that are going to be available to the inmates that are in there. I think that there's a lot of positives that are not being talked about in the community, and I think that's being overshadowed. And I'm curious about how the new sheriff will spin more positive things about that.
I'm not going to jump into the new jail and think that I know the programs and what's going on. I'm going to rely on our current jail administrator, Lucas, and I'm going to learn from him. And I'm going to watch the numbers coming in, and we're just going to work together as a team to better manage this jail so it's not a burden on the taxpayers of this county.
Yeah, it's going to take a little bit to come up to speed on that. Never ran a jail like that before. It's a very big facility. There's a lot that goes on up there, a lot of programs. The conference rooms are a big plus. I would rely on my staff up there. If we need a daily meeting, let's have it. What's going on? People are coming in. What's the expense going out? What kind of programs are we offering so that this jail is not always full, that we can maybe use it for something else someday?
I do know just briefly from being at some meetings about the jail that there are the different pods, and some of them are communal living and some of them are individual cells, so if people need to have the ability to be segregated, they can, and to make sure they're safe. But the jail does currently have mental health resources in there. It would continue along that, work with the jail administrator, whether it's chemical dependency or mental health, and work with the new jail system, how it's set up, depending on, I know that the pods are going to be separated out into different things, but I don't know all of the information on that, so I would have to pick that up as moving ahead as the sheriff.
Thank you for attending the foreign event tonight and taking the opportunity to gain knowledge and awareness of the Minnesota statutes and how your informed vote can direct how they impact our communities. Thank you to the candidates for taking their time tonight to share their perspectives on these mental health related issues and policies. Please feel free to visit each of the informed tables as you leave the building, which include information about NAMI of Itasca County, the Itasca County Local Advisory Council, and First Call for Help, in addition to copies of all the state statutes that we discussed tonight. A special thank you to ICTV and the Herald Review for covering the events for tonight, and for your wonderful and respectful interaction and questions to our candidates. May each of you have safe travels home, and good night.
Thank you.